Hi everybody, in this video we're talking about how to exercise your knees even when it hurts too much to stand. Welcome to the Health How-To channel where we talk about some great life hacks and easy tips to achieve better health. Please subscribe and share your best tips that you've found to be helpful for fixing your knee pain so that we can all benefit in our own personal journey to better health. Lingering knee pain can most commonly occur from cartilage injuries known as meniscus tears, ligament sprains, and arthritis. These conditions can cause immense pain, especially with weight bearing like standing and walking. Even getting up from a chair or getting out from the car can be torture. Maybe you've been told that you need to exercise or walk to help your knee get better. But what if it just hurts too much? Before we get into the knee exercises, let's first talk about why knee pain can start in the first place. There are things we can't change and things we can change to improve knee pain. 5 knee pain factors we can't change include: number 1, age. The older you are, the slower our healing potential becomes. The quality of our repair process can also become more like putting internal duct tape on our injuries rather than true regeneration. Meniscus injuries tend to occur most commonly in the 40s. Knee osteoarthritis can be seen on x-rays starting around 45 years of age. Most people won't feel pain at this point. Arthritic pain tends to start once people are in their 60s and increase to 40% of people in their 70s. Number 2, genetics. Go ahead and blame your parents for your sore knees. Knee arthritis is most commonly thought of as partly being a hereditary problem, but ACL sprains, for example, can be more likely to occur if your parents had them too. It likely has to do with inheriting loose ligaments that are more prone to injury. Number 3, cartilage wear and tear. Cartilage can wear away for no known reason and is generally referred to as age-related wear and tear. Cartilage can also have irreparable and progressive damage from previous injury. Number 4, bone or knee joint abnormalities that you were born with, like knock knees, bow-leggedness, and bone growth abnormalities, can contribute to poor knee alignment and increasing your chances of uneven pressure through the knees. And lastly, number 5, gender at birth. Being a woman makes you slightly more at risk of developing knee issues, thanks to our wider pelvises that only get wider after childbirth. A wider pelvis can put more strain on the inner knees and anterior cruciate ligament. Also, fluctuating hormones can cause increased looseness of the ligaments that link bone to bone. So, during certain times of the month, women can also have less stable knees and be more prone to knee injury. 4 knee pain factors that we can change somewhat include: number 1, muscle mass. When our leg muscles are weak from disuse, say from a sedentary office job, avoiding getting down to the floor or squatting, our knee becomes progressively more painful and the joint becomes more unstable. Your muscle strength and muscle mass can decrease significantly within just 5 days of bed rest. Number 2, knee alignment. Some knee alignments, like mild knock knees from a flat foot or weak hip muscles, can be changed with glute muscle strengthening and custom shoe inserts known as orthotics. Other knee alignment issues like hyperextension may require serious strengthening or bracing to improve. Number 3, joint flexibility. Our bodies were built for movement. Our muscles and joints are stimulated with appropriate movement. Much like a door that is never fully opened and gets stiff and rusty over time, our knee needs to be fully bent and straightened every day to stay healthy and self-lubricate. And finally, the last knee pain factor we have some control over is number 4, weight. Did you know that the main predictor of whether you will need a knee replacement surgery is a high body mass index? That makes it worth it to try to lose 5 to 10 pounds if your weight is above a BMI of 25. Of course, losing weight is never easy. Check out our videos on diet and weight loss for some tips. Research has shown that one of the best conservative interventions for knee pain from meniscus, ligament tears, or arthritis is strengthening. Which specific muscles need to be trained and why? The quadriceps are the big muscles that form the top of your thigh. When your quadriceps are weak, particularly the inner portion, your knee can feel like it gives out, or you have a lot of trouble going downstairs. Strengthening your hamstrings, which are the large muscles that form the bulk of the back of your thigh, are important to work in sync with your quads to keep your knee nice and stable. The more unstable the knee, the more friction, inflammation, and pain. Finally, strengthening your gluteal muscles, which form the bulk of your buttocks, will help control the alignment of your hips and knees to take the load off your knee, particularly the inner portion of your knee joint. So here are 10 knee exercises that are all done in sitting or lying that you can start with when it hurts too much to stand. They can all be done on the floor, a firm couch, or bed if you can't get up and down from the floor. All you need is a long towel. These exercises have the best results when you follow the sequence. Number 1, heel slide with towel. Sit on the floor with your legs straight ahead of you. Put a long towel or belt around your foot and hold onto the ends. Bend your knee while sliding your heel along the floor. Use a towel to help you bend your knee as much as possible. Hold for 5 seconds, then straighten your knee fully by sliding your heel on the floor so you're not taking the full weight of the leg. Repeat 10 times. If your knees are really stiff in the morning, this is the best exercise to do while you're still in bed, and you can use your bed sheets to do the pulling. Number 2, prone knee bends. Lie on your stomach. Bend your knee as much as you can. If you can manage to grab your ankle with your hands or a towel, you'll feel an even deeper stretch. Hold for 10 deep breaths. Number 3, calf stretch, part 1. Sit on the floor with your legs straight ahead of you. Put the towel around your foot and pull the foot back while keeping the knee straight. You should feel a stretch in the calf closer to the back of the knee. Hold for 10 deep breaths. Number 4, calf stretch, part 2. Keep the towel around your foot. This time, bend your knee slightly and then pull the foot back. You should feel a stretch in the lower part of your calf, this time closer to your ankle. Hold for 10 deep breaths. Number 5, hamstring stretch. Bend one knee and keep the other knee straight. Sit up as tall as you can and lean forwards from the hip to stretch the hamstrings. Hold for 10 deep breaths. Number 6, inner range quads, part 1. The quadricep muscles work to extend or straighten the knee. The last 20 degrees of knee straightening are the weakest, yet so functionally important. Sit with your legs straight in front. Place a small rolled towel under your knee as before. Push your knee into the rolled towel without lifting up your foot. Try to contract the top of your thigh and hamstrings at the same time. Hold for 5 seconds and repeat 10 times. Number 7, inner range quads, part 2. Start in the same sitting position as before. Press the back of your knee into the towel roll as you tighten up the top of your thigh and simultaneously lift your heel so that your leg is straight. Hold this position for 5 seconds. Repeat 10 times or until your quads muscle feels tired. Number 8, no equipment leg press. Sit sideways on the couch with your legs up against the armrest. Keep your knees slightly bent. Now push your feet into the armrest, trying to straighten up your knees. Tighten the tops of your thighs. Imagine you are going from sitting to standing. Press and hold for 5 seconds and repeat 10 times. Number 9, 4-way straight leg raise. I like to think of this as the human rotisserie. It's basically doing the same straight leg raise motion in 4 different positions. On your back, on your right side, on your stomach, and then on your left side. Try to keep your thigh muscles tight throughout the entire exercise to get maximum benefit. Let's first start lying on your back Then tighten up the top of the thigh and lift the leg up 3 inches. If you lift your leg up too high, the hip flexor muscles start to kick in. Repeat 10 times. Next, roll onto your right side. Keep your hips stacked on top of the other. Lift your leg up and repeat 10 times. Then, roll onto your stomach. If you have back pain when you lie on your stomach, you can put a pillow under your hips or belly to support the arch of your back. Then, lift your leg straight up for 10 repetitions. Finally, roll onto your other side, but this time lift the bottom leg 10 times to work the inner thigh muscles. And finally, number 10, bridge. Lie on the floor and press the back of your head, shoulders, and heels into the floor. Lift your hips up and try to keep your low back straight. Hold for 3 seconds. Slowly lower to the ground and repeat 10 times. Please subscribe and turn on notifications so you don't miss any health how-to videos where we talk about easy ways to improve your health. Thanks for watching, and I'll see you in the next video.